Hello friends, in this section of head and neck, I am going to describe thyroid gland. Most important topic so many times has come as a theory question, so you should know the details of thyroid gland. Starting with the thyroid gland, it is an endocrine type of gland. It has got two lateral lobes and a connecting part that is called as the isthmus. The shape of thyroid gland is H-shaped and it is located in the anterior aspect of the neck. The extension of thyroid gland, when you will see superiorly, it extends till the level of thyroid cartilage. To be more precise, till which level of thyroid gland it extends is the oblique line of the thyroid cartilage, and lower down it goes till the level of 6th tracheal ring. The 6th tracheal ring corresponds to first thoracic vertebra. Thereafter, coming to the weight of thyroid gland, approximately it is 25 grams in weight. What happens, certain conditions like in case of pregnancy and in case of menstruation, the weight of thyroid gland increases, slightly enlarges due to hormonal effect. The dimensions of thyroid gland, coming to the dimensions, it has got approximate length of 1.5 inches, width and thickness of 1 inches, and the isthmus has got half inches as the width and the length. It is the connecting link between the two lobes of thyroid gland. When we see in the case of thyroid gland, a small lobe sprout out from the connecting part, that is the isthmus part of the thyroid gland, and that lobe is called as the pyramidal lobe of thyroid gland. This pyramidal lobe of the thyroid gland is connected to hyoid bone, and that connection is called as levator glandulae thyroidae. Once more, the pyramidal lobe is connected to hyoid bone and that connection is called as levator glandulae thyroidae. So this was just an introduction about the thyroid gland. After that, coming to the capsules of thyroid gland. Now this thyroid gland is covered by capsule. One is the true capsule, other is the false capsule. The true capsule is formed by the condensation of thyroid tissue itself, and the false capsule is formed by pretracheal fascia. Pretracheal fascia is the fascia emerging out from deep cervical fascia of the neck, and this pretracheal fascia is forming the false capsule of thyroid gland. I will make one diagram with which you will understand all the external features, and also you will understand the capsules and where is the veins located. Now after that, we will discuss about the lateral lobe and the isthmus part of the thyroid gland. Before starting that, just have an idea where is the thyroid gland located. When you will see the thyroid gland, anterior aspect, it is related to pretracheal fascia, strap muscles and sternocleidomastoid muscle. Means anteriorly it has got relation with pretracheal fascia. Posteriorly, thyroid gland is related to prevertebral layer of the deep cervical fascia, and laterally it is related to carotid sheath. Means these three sheaths are actually in extension of deep cervical fascia and they are in close relation with the thyroid gland. Means this thyroid gland, if we can talk, it is anteriorly related to one of the extension of deep cervical fascia, that is called as pretracheal fascia. On posterior aspect, the thyroid gland is related to prevertebral layer of the deep cervical fascia, and on the lateral aspect it is related to carotid sheath. Thereafter, coming to the lateral lobes of thyroid gland, we will discuss the relations of lateral lobe of the thyroid gland. Now starting with the lateral lobe of thyroid gland, it has got anterolateral surface, it has got posterolateral surface, and it has got a medial surface. The medial surface is related to so many important structures. So we can summarize the relation of medial surface. We can just memorize the relation by just remembering the term, that is the two. So in the medial aspect, thyroid gland is related to two tubes. The two tubes are trachea and esophagus. Medial aspect, thyroid gland is related to two nerves. The nerves are recurrent laryngeal nerve and external laryngeal nerve. To be more precise, the exact location of this recurrent laryngeal nerve is between the esophagus and trachea. So it often asked as a viva question, where is recurrent laryngeal nerve located? The answer will be, it is located in the tracheoesophageal groove. Means the depressed area lying between trachea and esophagus is the location of recurrent laryngeal nerve. So we have seen the medial aspect of thyroid gland is related to two tubes, trachea and esophagus, two nerves, external laryngeal nerve and that of recurrent laryngeal nerve. It is also related to two cartilage, that is the thyroid cartilage and cricoid cartilage. It is also related to two muscles, that is inferior constrictor muscle of the pharynx and cricothyroid muscle. So we have seen medial aspect of thyroid gland is related to all these structures, and it is important for you to memorize all these structures because it often comes as an examination question, and they stress upon, the teachers will want to know whether you are knowing all the medial relation or not. So just remember two, and the two structures related are two tubes, two nerves, two muscles and two cartilage. Coming to the posterolateral relation. Posterolaterally, thyroid gland is related to carotid sheath. Now, this carotid sheath is exactly the extension of deep cervical fascia only. It emerges from the investing layer of deep cervical fascia, and carotid sheath contains three important structures. So we can say posterolaterally, thyroid gland is related to carotid sheath containing following structures. What are they? Common carotid artery, it has got vagus nerve and internal jugular vein. These three structures are related posterolaterally to thyroid gland. Thereafter, coming to its anterolateral relation. Anterolaterally, thyroid gland is related with some of the strap muscles. Most superficially, this anterolateral relation is by sternocleidomastoid muscle. The sternocleidomastoid muscle is covered by investing layer of deep cervical fascia. Just beneath the sternocleidomastoid muscle, it is related with the strap muscle. The relations of the strap muscles are following. It is related to following strap muscle anterolaterally. They are sternohyoid, sternothyroid and superior belly of omohyoid. So just having a summary of all these relations, once more I would like to summarize the relation. We have discussed three important surfaces relation of the thyroid gland, that is anterolateral relation, posteromedial relation and that posterolateral relation. To be more specific, that is medial relation. So once more, anterolaterally it is related to strap muscles along with sternocleidomastoid muscle. Medially it is related to two tubes, trachea and esophagus, two nerves, recurrent laryngeal nerve and external laryngeal nerve, two cartilages, cricoid and thyroid cartilage, and two muscles, that is inferior constrictor muscle and cricothyroid. The lateral relation, to be more specific, it is posterolateral relation. It is related to carotid sheath, and you already know carotid sheath contains three important structures: internal jugular vein, carotid artery and that of vagus nerve. Now we have discussed about these all relation. If you want to know the apex and base relation, so we have discussed about the surfaces relation. The apex of thyroid gland reaches till the level of thyroid cartilage, till the level of oblique line lying on the thyroid cartilage, and the base of the thyroid gland, it is related, means base of the lateral lobe of thyroid gland is related to sixth tracheal ring. The sixth tracheal ring corresponds to the level of first thoracic vertebra. So we have discussed all these relations of the surfaces. We have discussed the relations of apex and base. Now anterior border, posterior borders, if you want to discuss anterior and posterior border, anteriorly there will be superior thyroid artery, posteriorly where there will be the parathyroid glands. So parathyroid glands are very important for the secretion of parathyroid hormones, and inferior thyroid vein, inferior thyroid artery, all these structures are related posteriorly. Now, as we have discussed the lateral lobes in much detail, we will make a diagram for better understanding of the thyroid gland. We will take a transverse section at the C6 level of cervical vertebra, and we will see the relations of thyroid gland. Now coming to the relations of isthmus part of thyroid gland. Isthmus part of thyroid gland is connecting the two lateral lobes of thyroid gland. It is related on anterior aspect by the strap muscles. It is related by the strap muscle, which you already know, that is the sternohyoid, sternothyroid and that of superior belly of omohyoid. Posterior aspect, it is related to second, third and fourth tracheal rings. Posteriorly, it is related to second, third and fourth tracheal rings. And superior and inferior aspect of the isthmus. Superiorly, there is anastomosis of superior thyroid artery, and inferior aspect, it is related to inferior thyroid vein. With this, we have completed the general information, the general features of thyroid gland along with the relations of thyroid gland. Now coming to the arterial supply, the nerve supply and lymphatic drainage of thyroid gland. Discussing about the blood supply. So starting with arterial supply of the thyroid gland. The thyroid gland gets arterial supply from following arteries: superior thyroid artery, inferior thyroid artery, thyroid ema artery, and also branches from other important arteries like that of esophageal arteries, pharyngeal arteries, tracheal arteries. So starting with the details of each of these arteries. Superior thyroid artery is a branch of external carotid artery. It is supplying the upper 1/3 of the lateral lobe and upper half of the isthmus of thyroid gland. One of the important relation of the superior thyroid artery is it is related closely with the external laryngeal nerve. So superior thyroid artery is lying in close relation with external laryngeal nerve. So it is given importance because the surgeon has to keep this in mind while removing the thyroid gland. The second important artery giving blood supply to thyroid gland is inferior thyroid artery. This inferior thyroid artery is a branch of thyrocervical trunk. Thyrocervical trunk is a branch of first part of subclavian artery. The inferior thyroid artery, it is supplying the lower 2/3 part of the lateral lobe and the lower half of the isthmic part of thyroid gland. It is lying in close relation with one of the important nerve, that is a branch of vagus, that is recurrent laryngeal nerve. So we have seen there are two arteries. One is superior thyroid artery, other is inferior thyroid artery. Superior thyroid artery is related to external laryngeal nerve and inferior thyroid artery is related to recurrent laryngeal nerve. Now the third artery which is giving arterial supply to thyroid gland is thyroid ema artery. This thyroid ema artery is directly the branch of arch of aorta or from the brachiocephalic trunk. The fourth arteries are some of the accessory arteries, that is the branches of esophageal arteries, tracheal arteries and pharyngeal arteries also give blood supply to thyroid gland. So with this we have finished the arterial supply of thyroid gland. Now friends, come to the details of the venous drainage of thyroid gland. The veins which is draining the thyroid gland are following: superior thyroid vein, we have got middle thyroid vein, inferior thyroid vein, and sometimes we have got Kocher veins also. So coming to the details of each, superior thyroid vein is draining into internal jugular vein. Also the middle thyroid vein is also draining into internal jugular vein. Only the inferior thyroid vein is draining into brachiocephalic vein. Now sometimes what happens, there is another vein which is lying between that of middle and inferior thyroid vein. The location of this vein corresponds to Kocher vein, and this Kocher veins also directly drain into internal jugular vein. So we have seen following veins are draining the thyroid gland: superior thyroid vein, inferior thyroid vein, middle thyroid vein and Kocher vein. Among this, superior thyroid vein, the middle thyroid vein and Kocher vein will directly drain into internal jugular vein, except the inferior thyroid vein which is draining into brachiocephalic vein. After that, coming to the details of the lymphatic drainage of thyroid gland. The lymphatic drainage of thyroid gland corresponds to following points. The upper part of thyroid gland is draining into prelaryngeal lymph nodes. Means prelaryngeal lymph nodes will ultimately drainage will go to deep cervical lymph node. Coming to the lower part of thyroid gland, it is draining into pretracheal lymph nodes, and ultimately this prelaryngeal and pretracheal lymph node will drain into deep cervical lymph nodes. So we have discussed the arterial supply, we have discussed the venous drainage, and also we have discussed the lymphatic drainage, and also seen the relation of nerves with the thyroid gland. Now coming to the applied aspect of thyroid gland. Why have I so much stressed about the nerve relation? Because what happens in cases of tumors or cancer, we want to remove whole of the thyroid gland. That operation is called as thyroidectomy. So if the surgeon wants to remove the whole of the thyroid gland, he or she should keep in mind the relation of the nerves. So while ligating the superior thyroid artery, it should be ligated close to the apex so that we are not going to injure the external laryngeal nerve. Now coming to the relations of the base, we have seen that the inferior thyroid artery is related in close association with recurrent laryngeal nerve. So while ligating the inferior thyroid artery towards the base, care should be given not to injure the recurrent laryngeal nerve. So this is an important relation which should always be kept in mind while removing the thyroid gland in cases of thyroidectomy operation which is done for tumors. Now the second important applied aspect is mostly it is related to the embryological aspect. As we know, thyroid gland is one of the most early developing gland, and the remnants of it can be found, means developing thyroid gland remnants can be found in the form of thyroglossal duct. Sometimes the third point is lingual thyroid gland. Sometimes what happens, the thyroid gland doesn't descend at its correct position. The correct position, as we have discussed, the apex is towards the oblique line of thyroid cartilage and the base is towards the sixth tracheal ring. It remains at the posterior aspect of the tongue. It doesn't descend down at its correct place, and that type of thyroid gland is called as lingual thyroid gland. So we have discussed thyroid gland in details. Along with thyroid gland, I would like to give some important points about parathyroid gland. Parathyroid gland is an important endocrine gland having the secretion, gives the secretion of parathyroid hormone. Along with it, it is also involved in calcium metabolism. The relation of parathyroid gland is important. When you will see the thyroid gland from the posterior aspect, you can see two pairs of parathyroid gland, means we have got two superior parathyroid gland and we have got two inferior parathyroid gland. So it is often asked as a viva question that superior parathyroid gland develops from which part and inferior parathyroid gland develops from which part. So it is developing in close relation with pharyngeal pouches. So the superior parathyroid gland is developing from fourth pharyngeal pouches, and the inferior pair of parathyroid gland is developing from third pharyngeal pouches. So you should keep in mind the superior is developing from fourth pharyngeal pouch and the inferior is developing from third pharyngeal pouch. Where it is located, it should be kept in your mind. Where is the location of the parathyroid gland? It's just onto the posterior border of thyroid gland. One more important point I could like to stress here, that parathyroid gland is lying on the external aspect of thyroid gland. Sometimes what happens, it is embedded inside the fibrous capsule. I have shown you the diagram of the capsule of thyroid gland. You have seen that it has got a outermost covering which is pretracheal fascia, which is forming the fibrous capsule, which is forming the false capsule. Sometimes this pair of parathyroid gland is embedded inside the capsule. Sometimes it is embedded inside the tissues of thyroid gland. But most aspect it is lying posterior or external to thyroid gland on the posterior border. Now the exact location of superior parathyroid gland is in close association with inferior thyroid artery, and the exact location of inferior parathyroid gland is towards the base on the posterior aspect of thyroid gland. Now what happens, sometimes there can be missing one or two lobes, means inferior parathyroid gland can sometimes be absent, and at times what happens, inferior parathyroid gland is found in the lower aspect, means it is found in the superior mediastinum. So sometimes what happens, we will not found when we will take out the specimen of thyroid gland, there is no parathyroid gland there and it is descended down into the superior mediastinum. Coming to the arterial supply, inferior thyroid artery, which is a branch of thyrocervical trunk, which is a branch of first part of subclavian artery, is giving arterial supply to parathyroid glands. Coming to the lymphatic drainage, they are drained by paratracheal lymph nodes, which will ultimately drain into deep cervical lymph nodes. The venous drainage is corresponding to parathyroid veins. And coming to the nerve supply, sympathetic is from the cervical sympathetic ganglion, but the secretion, means the secretomotor secretion or the secretion of the hormones which is released by the parathyroid gland is under hormonal control. So in brief, we have also discussed the parathyroid gland lying on the posterior aspect of thyroid gland. So what is most important, I just want to recapitulate in thyroid gland. You should know the relations of thyroid gland. You should know to make a precise diagram showing the relations of thyroid gland, a transverse section of thyroid gland showing its all relations of the surfaces. You should know the blood supply of thyroid gland along with its nerve supply, and what is the importance of the relation of nerves with the arteries. Now we are going to make a diagram showing the relations of thyroid gland. So firstly, I'll make the outline of thyroid gland. So the relations of thyroid gland, which is explained in this diagram, is showing the transverse section. So we have taken the transverse section at the 6th cervical vertebra, and then I am just describing the relations of thyroid gland. So these are the relations. Firstly, make the outline of thyroid gland, label it as a thyroid gland. Thereafter, make the muscles. So all the relative muscles is made. Connect the muscles with investing layer of deep cervical fascia. So inside the thyroid gland, and another gland is made with purple color, that is the parathyroid gland, and the green color which is connecting the muscles, which I have made in brown color, is the investing layer of deep cervical fascia. Now label all the muscles. Sternocleidomastoid muscle is the most outermost. We have sternohyoid and we have got sternothyroid muscle along with superior belly of omohyoid. So these are all muscles lying in close relation with the thyroid gland. Now what you can see in this diagram, what I have already explained when I was explaining the relations of thyroid gland, I have explained that thyroid gland is anterolaterally related to following muscles. So you can see in the diagram, it is anterolaterally related to sternocleidomastoid muscle, sternohyoid, sternothyroid, and superior belly of omohyoid. Now coming to the medial relation of thyroid gland. So a blue color structure is made. This blue color structure which we have made is trachea. Then the orange color structure is made, which is esophagus. So two tubes are related medially of thyroid gland. One is esophagus and the other is trachea. So these two tubular structures are lying in the medial relation of thyroid gland. Thereafter, make yellow color recurrent laryngeal nerve. So what you can see, there is a groove between trachea and esophagus, which is called as tracheoesophageal groove, and in that tracheoesophageal groove there is location of recurrent laryngeal nerve, which is a branch of vagus nerve. Thereafter, just posterolateral to it. Now posterolateral to it, we have made a green circle. Actually that green circle is carotid sheath. Inside, just making the contents of the carotid sheath. So use red color for the artery, blue colors for the vein, and yellow color for the nerve. So inside the carotid sheath, we have got the three important contents: vagus nerve, internal jugular vein, and common carotid artery. So you can appreciate in the diagram that these carotid sheath and the structures inside the carotid sheath is posterolaterally in relation to thyroid gland. So what you can appreciate in the diagram, posterolateral to thyroid gland lies the carotid sheath with its content, anterolateral lies all the muscles, and medial to it lies the trachea, esophagus, along with recurrent laryngeal nerve. So these are all explanations of relations and diagrams. Make this diagram showing the relations of thyroid gland. Thank you. Now in this diagram, I am going to explain the thyroid gland, external features of thyroid gland. So before that, just make the outline of thyroid gland. After that, color the entire gland in orange color. So what you can note here, that I have made the thyroid gland and in between a small lobe is protruding out. That lobe is called as the pyramidal lobe. In thyroid gland, we are going to make two lateral lobes and a connecting part, which is the isthmus. The shape of thyroid gland, as you can see, it is H-shaped. On the upper aspect, make a outline of hyoid bone. Thereafter, an outline of thyroid cartilage. This purple color I have used for making the thyroid cartilages. Lower down are the tracheal rings. And the green color structure which is connecting the small lobe from the hyoid bone. So connect the lobe with that of hyoid bone. So in between you can see the thyroid cartilage, the hyoid bone, and the pyramidal lobe. Label all the structures. Lower down we have got isthmus connecting the two lateral lobes. The green structure which you are seeing here is called as levator glandulae thyroidae. This levator glandulae thyroidae is connecting the pyramidal lobe of the thyroid gland with that of hyoid bone. So this extension which is connecting the hyoid bone and that of pyramidal lobe is called as levator glandulae thyroidae. Meanwhile, let's write the vertebral level of the thyroid gland. The vertebral level is from C5 to T1. So the whole extent of the thyroid gland is extending from 5th cervical vertebra till the level of 1st thoracic vertebra. And what you can see that the lower aspect of thyroid gland is called as the base, and the exact location of it corresponds to 6th tracheal ring. So this is the diagram which is showing the external features of thyroid gland, and it is also showing the extent of thyroid gland. Thank you. Now starting with the diagram of thyroid capsule. So I am going to make a diagram showing the true capsule and the false capsule of thyroid gland. Why it is important? Because an applied aspect is related to this capsule. I will draw all the capsules, the true and the false capsule, and I will also show you the location of thyroid vein, and then I will explain you the plane of cleavage, means where is the surgical incision given to remove the thyroid gland, so we are not going to injure the thyroid vein. So starting with this diagram, firstly draw the outline of the thyroid gland and then color the entire thyroid gland. So what I have made is the outline of thyroid gland here. Then start on the outer aspect, use a green color to make the capsule of the thyroid gland. So what I am making here is the capsule of thyroid gland. Encircle whole of the thyroid gland. This is the true capsule of the thyroid gland adherent to the thyroid gland. On outer aspect, I am making the another capsule of thyroid gland, which is the false capsule. I have made the false capsule of thyroid gland. This false capsule of thyroid gland is actually made by the pretracheal fascia, which is a modification of investing layer of deep cervical fascia. So this pretracheal fascia is derived from the deeper aspect of investing layer of deep cervical fascia, and it is covering the whole of the thyroid gland on outer aspect of the true capsule. So mark with violet color and outline it and name it as false capsule. Now after labeling the true and false capsule, you are exactly knowing where is the true and false capsule located. Thereafter, inside the thyroid gland, means what we are drawing inside is the thyroid vein. So these are thyroid veins. So you can see in the diagram, the location of thyroid vein is inside the thyroid gland, means it is inside the true capsule. So just for preserving the thyroid vein and preserving the bleeding, so that the bleeding doesn't occur, we give the surgical incision in between true and false capsule. So this red color broken lines are showing the incision given in the thyroid gland, to take out the thyroid gland. So this surgical plane of cleavage is exactly lying between the true and false capsule. Thank you.